All right. I'm Mike Christian. I'm with From the Future. I'm the CEO. We do VR solutions for education and training. We have a platform that supports lots of headsets. It's geared towards AR. Right now, we're focused on VR. And one of the things we've been talking about is, how our work, present and future, can help medical training, healthcare training. I think the possibilities are endless. And joining me today is my friend Jose Rojas from UTMB. Jose, you want to introduce yourself?
Well, thank you, Mike, and I appreciate you inviting me to do this with you. We are interested in virtual reality, augmented reality here at UTMB. We have a couple of platforms that we've looked at. Been in healthcare for nearly 40 years, or maybe a little bit over 40 years, in respiratory care in particular. So I'm the chair of the Department of Respiratory Care here at UTMB. And we've got a master's entry-level program that we're starting. And so we train people to be respiratory therapists. We do that training in laboratories and in clinical, but again, there's some limitations to space, and we're wanting to harvest the potential in virtual reality and augmented reality to try to improve the opportunities for our learners.
That's great. And I will point out that UTMB Health is fantastic. They've got some wonderful people there. They're doing some amazing things in simulation, and their education training's top notch, which is why I, talked to them and why I brought in Jose, because, nothing's ever perfect. And I think we're on the edge of some wonderful stuff when it comes to taking this to the next level with VR. So part of that process is identifying, what's wrong with current methodologies and current ways. Some are better than others. And so I've listed just a few of the main ones here, and we don't necessarily need to go through these point by point. But what I'd like Jose to do is talk about the issues that he's most passionate about. And Jose, let me know if some of these follow-up slides need to be shown to support what you're talking about.
Well, I think I'd go into the next slide, because the next slide is kind of an issue of why augmented reality and virtual reality. And I apologize for the size of this slide, but it shows you an idea of an exam, a credentialing exam in respiratory care. I'm a registered respiratory therapist. I became a registered therapist in 1982, taking an examination that was called the clinical simulation exam. And back in the day, it utilized a latent imaging marker. So I had a booklet, and then with a latent imaging marker, I had to show some competence. I was provided a patient scenario, and I had to navigate that scenario and show that I understood respiratory care and how to take care of different patients. In about the mid-'80s, that exam format changed to computer-based format, still called the clinical simulation exam. But in that exam, a candidate is presented with a scenario. And so in this scenario, you're given that the patient is on a ventilator, and then you actually have to decide on things that you want to information that you want to gather and decisions that you want to make based on that information that you gathered. Well, the problem with the exam, and the exam has been much the same since the 1980s, it verifies whether someone is competent or not, and you earn the credential. The pass rate nationally, first time for that exam, has hovered around 60%. And I don't think it's because educational programs are bad at what they do, or that the therapists are incompetent. I really think that the format can be very distracting to students. And so that's why we move towards trying to use simulation as a way of helping students. So the student is graded immediately when they make choices. And in a linear exam like this, you're given a drop-down list of things that you could pick, and you could easily be distracted. You wouldn't necessarily pick the first thing that you would do if you were at the bedside in a patient's room. And so that's why we moved to using simulation as an example. So here, the student would be going down the drop-down list, and they might pick 12-lead EKG. That's the first thing that was on the list. Might be a good thing to do, or it might be a bad thing to do. In this instance, wouldn't necessarily have been a very good thing to do. Probably the best thing to do is almost down at the bottom of the list. And so if you're reading through, you may pick that last, right? Not necessarily get good points or get a lot of points. And so we thought taking simulation to try to make that scenario come to life would be really important. So if you go to the next slide, That's what we've done in our health simulation center. So we can do the same type of scenario in simulation. And we could do it with an individual student, or we could do it with teams. Here you have the gentleman who's at the foot of the bed is one of our students. He's a respiratory therapy student. The others are actually physicians who are at the bedside looking at that same type of patient, and trying to train them. And so you can use simulation for multiple types of trainings. One, to train the competence of the person at the foot of the bed, but you could also train and test the competence of the team. In this instance, the ventilator, the machine that you see here, is actually alarming. And now you have all of these people at the bedside trying to figure out what's wrong with the patient in the bed. And some are easily distracted. So with virtual reality, could I have everyone in the room? In this simulation setting that we have everyone there, but we had to set it up and it's labor intensive. And not everybody would necessarily be ready for prime time, if you would. If we could use virtual reality, augmented reality, to test their readiness to come into high stakes, we think that would be pretty good. And those are the things that we've been doing with our virtual reality platform. If you go to the next slide. In the previous scenario, you had a patient or the student would be given a scenario, and then you go in and you pick different things. Well, the reading of the scenario could actually distract the student. Here, using virtual reality, augmented reality, you could actually have hotspots and you could run the simulation. And if you could track with heat maps, the student's eye motion, you could show that they would get better over time. Here you have a novice, 3 weeks of training, they become expert. And so part of that is, I think, things that we can do with virtual reality. I'm going to stop for a second and probably let you interject.
You might have cut out. You cut out for me just a little bit there, Jose.
Okay, I would pause there, and I said I'd let you interject. It was kind of the idea of some of the things we thought we could do.
Okay. Yes, and I did want to add something. So this is a 360 image type scenario with information tokens. How could you see the higher level, more real-time interactive VR taking this to the next level?
Well, I think it would create a little bit more realism. So one of the things that you would do is that you could truly test what someone is doing. If you had the ability to track eye motion, to get a map, it gives the individual the ability to practice what they would do at the bedside without having the mannequin set up. And again, you could develop some level of competence. If you're using VRAR to show that you are competent, now you could go into a scenario of simulation where you have a whole team that are ready. So it's being able to, again, get you to prime time, being maybe more efficient in the ability to train.
So having the ability to get hands-on, to be multi-user, so that you could have a team working on their part of the equation, so to speak, or their role, would be helpful. I know that intubation and some of that is and I'm stepping outside my expertise here. From what I understand, it's a two-handed procedure that requires some skill and some knowledge. And some of that knowledge is dependent on what's going on inside, correct? So
Correct.
A dummy might have limitations on the feel for that. Certainly with VR, you don't have haptics, but you do have additional visuals and information to let you know what's going on inside the body, right?
Correct. And I think you bring up a great point. The idea of haptics and some feedback, getting the feedback, whether it be through haptics or maybe a visual cue, becomes very important. And so in this mannequin that you see that's intubated, one of the procedures that clinicians have to do is that they have to advance a tube into the airway to suction the airway. And they're told, advance the tube until you meet resistance. Well, sometimes you could get resistance not because it's part of the patient, but it's just part of the setup. So being able to see inside of the tube could give you some of the feedback that you'd get with haptics, right? And so training the individuals. I think those are the types of things that you may be able to do. I think you go to the next slide. This is another one that, CPR is an example where you need some feedback, some haptic. And it brings to mind a clinical experience that we had. I was doing CPR on a person that was 300 pounds. And to be able to get good compression, you have to have a backboard underneath the patient. he was pretty heavy, and so the backboard that they put underneath him was a lunch tray. And I didn't feel like I was getting much compression. And the more that I compressed, I pushed down so heavy that the tray broke. And
Oh
so
my.
the feedback that I got is I thought I'd gone through the guy's chest, which
Wow.
at the time was a scary feeling. But it's the idea of getting some haptic or maybe some visual cue that says, to now compress effectively. Maybe I couldn't get the feel of pushing down on his chest, but if I had some meter that was telling me, this is a good compression, or if I needed to give the person a breath, did I blow deep enough? Was I getting that type of breath? That might be something that we could see. The idea of if you had an endotracheal tube in place and you wanted to pass the tube down, have you gone where you need to go? Do you need to make a turn? So that type of feedback, I think with VR, AR could be very useful in training our students to get to now the live scenario.
Absolutely. I think the future, which is one of our slides coming up where we talk about haptics, is critical. I will point out to some of our viewers or some of our listeners that even with the limitations of today's VR, there's quite a bit you can do to make up for it, at least to teach the technical proficiency. So even with the limited vibration of hand controllers, you can indicate pressure with the frequency of vibrations, where a full vibration is top pressure, and then less frequent vibrations are not where you need to be. So you could even use that to indicate feedback and positioning. And of course you can do, augmented graphics on top of what you're doing to indicate, depth and pressure as well. So at least they have a technical learning, and then they have to go to a real simulation or a real scenario to actually get that live hands-on feel and develop a feel for that. So yeah, how does VR help all this? We've talked about it a little bit. So I think, education in general, I think what we're looking at with VR is, faster and deeper learning. I think it's going to change in the future. It's going to change how we educate, and it'll be interesting to see how well we make the most of it. I think the barriers right now for at least content are, the expense and the time it takes. But once it's there, it lowers the barriers for people looking to get into, higher level jobs or learning, because the VR is much more accessible. It can be done remotely, and it's scalable. What are some things you're excited about when it comes to VR, solving some of these problems, Jose?
Well, I think what you hit on is the scalability, but one of the things that we really didn't talk about, but I think you probably would tell me that you could do, is the analytics. Right now, if I'm doing live simulation, the analytics that I got to count on is the person watching the professional or the pro watching the student and being able to give feedback. Did you compress deep enough? Did you, from time the start of the scenario till when you acted, was that adequate? Did it take too long? So I think in the VR setup, in the AR setup, the ability to be able to have the analytics to say, what was the time it took from the time you walked into the room to the time that you put your hands on the patient's chest to actually listen to breath sounds? Were you distracted by noise that was in the room? Did your eyes go to the noise, or did you go immediately to the patient and to where the problem was at? And being able to capture that, I think in VR, AR is something that we're very excited about. I think the analytic that you can get out of that, so that you could tell how long it took for someone to go from novice to medium expert or the great expert. And that's something that we don't currently have now. Just if my ability to watch 3 students, I can only watch one person at a time. I think artificial intelligence, the analytic is tremendous.
Yeah, that hits several of these bullet points. That's really a really good point. I'm going to skip this one. So just briefly, we're running out of time. We're right at time. So again, I would like to say just the haptics are an interesting thing to watch in the future, because even when like I mentioned with the handheld controllers, we can make the most out of a little bit. And then just a holistic approach. I think medicine's going that way anyway. So I think we do the same thing with VR and AR, where you have group training, multi-user training, and the different roles are integrated from start to finish. I think those are very, very exciting things to me. Do you have any last words or things you'd like to share, Jose?
And to your point is for group training, I would love to have this type of product. Next week, we're doing a training with nursing and with respiratory. And so the volume that we have to get through, we've got to get over 150 students through in an 8-hour period of time. And again, if they would have had some experience beforehand, and you'd have an idea of who are the better learners, and so you're not trying to segregate them and do things about improving. I think that would be tremendous. And that's something we don't have, but we're looking forward to trying to get. And we'd love to partner with someone to try to make that happen.
Yeah, I think that's fantastic. So we're right at our time. Maybe